Can an infection cause your blood sugar to rise? Now, if you've been monitoring your blood sugar levels as a way to optimize health, you may have encountered some unexplained rises in blood sugar and may have even been wondering this very question. If that's you, you're in the right place because I'm here to answer that question in today's video, plus share a proven way for this to not happen down the road. Let's get started. Hi, I'm Dr. Kelly Shockley, Doctor of Cause, Chiropractic, board certified in sports medicine, and specialized in clinical nutrition. Welcome back to my channel where every Monday and Wednesday, I am sharing my strategies with you that I've been using in my clinic with patients here locally and also via telehealth since 2005 to help you discover the why behind your blood sugar spike or the why behind your symptoms or diagnosis. Once you know the why behind the problem, you will now know how to actually heal the body and achieve optimal levels of health, which I like to call total body mastery. So give a little love tap to that subscribe button. That way you're always up to date with the latest behind closed doors methods and strategies that I have for you. And as always, timestamps are right below this video. I value your time and you already know why you're here, so let's just get to it. In this video, I'm going to be sharing with you exactly what impact does having an infection have on your blood sugar levels so that you can have that answer once and for all. Then I'm going to be sharing with you 8 surprising things that could actually be creating some of those spikes that you're experiencing. And finally, I will be sharing with you the only proven way to not only take care of an underlying infection, but also how to regulate blood sugar levels once and for all so you no longer have to continue monitoring and spinning your wheels at what do you need to do next. Let's get started. All right, what impact does having an infection have on your ability to regulate and control blood sugar levels? Well, it depends. Ultimately, people who are not diabetics can get away with a little bit more than what diabetics can. The truth of the matter is, though, if you have an underlying infection, it could be part of why you're never being able to fully balance your blood sugar level. And the reason being actually comes more from having too high of blood sugar to begin with. It hampers your immune system's response to infection. So it works actually in that direction. Higher blood sugar levels suppress the immune system. Then the immune system's not able to respond to the critters that are in your body that shouldn't be there, the viruses, the bacteria, whatever. And it creates this kind of vicious loop that the body gets in. So having an underlying infection absolutely can be a contributing factor to why your blood sugar is not actually ever being regulated, even sometimes despite medication. I actually have had patients like this very issue. And there's one type of underlying infection that is very much related to not being able to get your blood sugar levels in check. That is infections in the mouth. I can tell you about a case in particular. I have a gal who I've been working with now for a while, and her long story short is she ended up in the hospital. She had cysts in her pancreas. They incredible pain in the region of her liver. Nobody knows what's wrong, giving her all kinds of heavy narcotics to manage her pain. And ultimately, she has very uncontrollable blood sugar level. Her hemoglobin A1C, which tells us more so what that looks like, is really high. And they've put her on all types of different medication to try to lower her blood sugar level. Well, she came to me and I did complete testing and we determined that her immune system's suppressed. It's like the reserves have been taken, which is oftentimes the sign of an underlying infection, chronic level of infection. And there's toxicity issues and all these other things. But what was key with her is she is someone who smokes and she has gingivitis. So she has all of this infection in her mouth. So I told her, we've got to get that taken care of because your blood sugar level is never going to normalize despite them even trying to give you insulin to regulate blood sugar because it's not taking care of part of the underlying cause of why your blood sugar is staying high. Okay, so ultimately, she's gone through, had a bunch of treatment done for her gum lines, had a lot of oral health, taken care of. We've been supporting her through the process, and she is finally starting to make some headway. Now, we have other things that we have to work on with her. But even the dentist that she went to, the specialist for the gums, was like, your blood sugar is never going to normalize until you get your mouth taken care of. So if you have anything happening within your mouth specifically, we know that that can affect the cardiovascular system, But here's another component as to what it can help. And ultimately, oral health affects everything in your body as well. So make sure you're taking good care of your mouth, and if you have a bad tooth or you've got, gum disease, that you're taking the strides necessary to remedy those issues. So I'm curious, I know you're already asking the question about the infection, but did you realize that infection in your mouth specifically could be part of what's creating this inability to regulate blood sugar levels? Just let me know your response in the comments down below. Now, what are 8 different surprising things that could totally be spiking your blood sugar without you even knowing it, that are actually not food related? Number 1 is a sunburn. Anytime you're dealing with like pain or stress, which the burn, if it's pain and stressful, that can elevate your blood sugar levels. Now, artificial sweeteners, I know I said not food related, it is food related, but we've been led to believe that these artificial 0-calorie sweeteners have no impact on our blood sugar level, and that couldn't be further from the truth. They can actually create spikes as well. Coffee is another one. Now, this is not sweetened coffee, just coffee itself. Some people are sensitive to the caffeine, and the way that their body responds, you will see a spike in their blood sugar level. So if you'd like to drink black coffee, but you're noticing that your sugar level is always elevated after that, then maybe you are one of these people who is sensitive to the caffeine and the makeup of the coffee. Another factor is having a bad night of sleep. Anytime you lose sleep, your body's ability to produce insulin, which is the hormone that helps take the sugar from your bloodstream and put it into your cells, which would then lower your blood sugar level that you're measuring, your body's not as good at producing it. So a bad night of sleep could be part of why your blood sugar levels have elevated again. Sometimes it's just the time of day. People, as the day goes on, oftentimes because of just the different variables, no matter what you're eating, but the stress levels and, some other factors we're going to talk about here in a second that I don't want to give away, it can be more difficult to regulate blood sugar levels later in the day versus earlier in the day. And then the flip side of that, there's something known as the dawn phenomenon. And this is all related to different hormone levels in the body, but sometimes it's the result of just where those hormone levels are at in the morning that blood sugar levels can spike in relationship to. Another one that I was starting to tell you, but I stopped, is dehydration. The reason why dehydration can elevate blood sugar is because you don't have as much hydration, which ultimately means your blood isn't as liquidy, for lack of a better word. It's more viscous. Ultimately, that means the blood sugar is more concentrated compared to if you had more volume of hydration in your body, which goes straight to your bloodstream. And then one of the last things that is kind of odd that nobody would think of are different nose sprays can actually spike blood sugar levels. Part of it is because some of the chemicals that they use actually trigger your body to increase blood sugar levels or to convert different tissues in the body to more blood sugar. So those are just some 8 surprising things that can also contribute to the spikes in blood sugar. And know that it is normal for your blood sugar to elevate and decrease kind of throughout the day. That's partly associated with eating. We just want to make sure we're not spiking way off the chart and that the body recovers the way that it should. One of the easiest ways to help normalize blood sugar levels is make sure you're moving. Use your body parts. Your muscles are responsible for using the most amount of sugar. So it's an easy trick that you can use. If you're seeing that your blood sugar is going up, get your muscles working so that they burn some of that excess sugar that's in your blood. And that will help you bring it back down naturally. Now, before I get into the best method for actually maintaining blood sugar levels and killing off infections at the same time, just wanted to take a moment to remind you, hit that subscribe button, turn the notifications on, give me a big thumbs up down there too while you're at it. I appreciate it, and I don't want you to miss out on a future episode so that you can have all kinds of empowering information to help you be able to take back control of your health and achieve total body mastery. So what's the best method for maintaining blood sugar and ending infection altogether? It's actually being able to look at you as a whole and getting an appreciation for what's going on beneath the surface. Maintaining and monitoring blood sugar levels is like one little variable. It's one little metric about your health. And there's so many more things that you could look at that would give you a clearer picture of what is going on inside of the body. So I recommend complete and proper testing. If you have an underlying infection, we got to figure out why. If you're doing all of the things that we already talked about in this video, and you're eating right, and you're exercising, and you're managing stress, and you're still finding that your blood sugar levels are not responding the way that you would expect, well, you've got to figure out what's not working in the body. What's wrong with your body? What's wrong with your health that this is what you're dealing with? Okay, so the only way to figure out your why is through complete and proper testing that unfortunately you can't have done within the medical world because it's not how that system operates. So if you're sitting there wondering, like, how in the world am I going to do this? How do I find the why? How do I have complete and proper testing done? Don't worry, I've got you. Go to the link right below this description, click on it. It'll take you to the page where I explain exactly all the details to how do you make this possible for yourself. I hope that today was informative. I would love to know if any of those surprising blood spikes were ones you had not heard of before. I'm always here for you. Ask your questions, leave feedback, and let me help you on your health journey. I hope today was great, and I look forward to seeing you on a future episode. God bless.